Hello, welcome to Info Medical Cards. I'm Dr. Sharath Ravindran. In the previous video, I mentioned that working in Germany as a doctor requires more than meeting formal criteria. Today, I want to address the most decisive factor, the language proficiency. In the German healthcare system, language proficiency is considered as a core clinical competency. It is not treated as an administrative formality, but as an essential requirement for safe medical practice. Germany follows the common European framework of reference for language, or otherwise called as German Language Framework, CEFR. For doctors, the relevant levels are B1, B2, and C1 medical. B1 level or basic functional German. It is required for everyday communication, simple conversations, and basic written understanding. However, it is not sufficient enough for the clinical works. B1 level represents only the basic functional German. It is only a foundation and does not qualify a doctor for clinical responsibility. B2 or general professional German. It is actually required for licensing step. However, it is not alone sufficient for a safe practice. It can clearly be used to communicate daily and explain your clinical ideas. B2 demonstrates general professional language ability. However, B2 reflects language capacity, not clinical readiness. C1 medical German reflects the ability to function as a physician in real clinical settings. It is directly linked to patient safety. With C1 level or C1 medical German level, you have the clinical proficiency, you can communicate with the patient, you can have a proper case presentation, medical documentation, and do a proper clinical discussions. Next, we are going to be discussing about the language exams for doctors. Germany does not rely on a single language examination. Different exams assess different competencies. General German exams or the B2 language exam. General German exams such as Goethe, TELC, and ÖSD or Austrian German Language Diploma certify overall language proficiency and are commonly required during the approbation process. Passing a B2 exam does not indicate your clinical readiness. Second and most important language exam for doctors is called the Fachsprachprüfung or FSP. The Fachsprachprüfung or the FSP is a key medical language examination for doctors. It evaluates doctor-patient communication, structured history taking, case presentation, and medical documentation. Usually, medical knowledge and treatment decisions are not tested here. The level only corresponds to C1 medical German. What is expected in practice? From the first working day, physicians are expected to communicate clearly with patients and colleagues, understand the nursing handovers and their questions, and document clinical decisions precisely. Inadequate communication is approached as a patient safety issue, not as a personal limitation. Perfection is not expected. Accents and minor grammatical errors are acceptable. What is required is clarity, structure, and reliability in communication. Most physicians experience rapid language improvement once clinical work begins. I would like to add on a regulatory clarification here. ÖSD or Austrian German Language Diploma B2 is accepted in several federal states as proof of general language proficiency, comparable to the Goethe or TELC certificates. Acceptance is strictly state specific and must always be verified with the competent approbation authority of the respective state or Bundesland. So the key take-home message from this video is that language proficiency is not a barrier, but a professional responsibility. It enables safe patient care and effective integration into German healthcare system. Thank you for watching my video. Stay tuned for more information. Bye.